Hi, my name is Dr. Sukhchain Singh. I'm a cardiologist with Kettering Health. Today we're going to talk about early heart attack care. Now, before we get to heart attack care, let's learn what is a heart attack. A heart attack or myocardial infarction occurs when blood flow to your heart muscle is suddenly cut off. Heart muscle below this blockage starts to die within a very short period of time. Heart attack is very common. Every 42nd an American has a heart attack. Over 600,000 new heart attacks and approximately 200,000 repeat or recurrent heart attacks occur every year. Out of these approximately 800,000 heart attacks, approximately 170,000 are silent heart attack or perceived silent heart attacks. Average age of heart attack in men is approximately 65 and women it's 72. Unfortunately, only approximately 50% of patients who are having symptoms consistent with a heart attack reach the hospital within 2 hours of symptom onset. That is essential to save your heart muscle. Approximately 14% of patients who have a heart attack die of it. Heart disease overall remains number one cause of death in US, and a heart attack is a major part of that. Awareness of the signs and symptoms of heart attack is lacking. Based on a large survey, only approximately 55% of women and 45% of men could accurately describe 5 most common symptoms of heart attack. Awareness also varies by race. In Asians, awareness is the lowest. Now, this map shows the prevalence of heart attack by state. Blue color represents highest prevalence of heart attack, and you can see that Ohio falls into that category where prevalence of heart attack is the highest. Now let's talk about the symptoms of heart attack. What are the most common symptoms? Now, chest pain, chest pressure, or heaviness in the chest remains most common symptom of heart attack, especially in men. Now, this chest pain or chest pressure doesn't need to be as dramatic as portrayed in some Hollywood movies. It could be more subtle chest pain or chest pressure. Sometimes shortness of breath is a predominant symptom. Other times it could be just discomfort or tingling, numbness in your arms, shoulder, neck, or back. In women, elderly, and patients with long-standing diabetes, symptoms of heart attack could be even more subtle and vague. Such as heartburn-like feeling, unusual tiredness, nausea, vomiting, sudden dizziness, cold sweat. Key is recognizing when something feels out of the ordinary, the symptoms that you never had before. If you suspect a heart attack, do not waste any time. Call 911 right away. Time is a muscle here. Unfortunately, too many patients wait too long to call 911 or seek help. Now let's talk about diagnosis of heart attack. When you arrive at emergency room, your emergency room provider will take a brief history and focused exam. An EKG is typically performed. Now, EKG is usually performed by EMTs en route to the emergency room. If they notice evidence of heart attack on an EKG, they can alert the cath lab directly, bypassing emergency room and thereby saving precious time. So if a heart attack is suspected, initial treatments include oxygen therapy if needed, aspirin, and other antiplatelet agents to prevent further clotting, nitroglycerin to improve blood flow to your heart muscle and relieve chest pain. Pain-relieving medications such as morphine, a beta blocker could be used. Now, once a heart attack is confirmed, most effective treatment is percutaneous coronary angiogram or angioplasty that is most effective when performed within first 1 to 2 hours of symptom onset. This procedure uses a thin, flexible balloon catheter that is threaded across the blockage to widen it, and then a stent is placed. A stent is a thin, small mesh tube that's put inside the artery so that it stays open after angioplasty. In rare circumstances, open heart surgery may be needed. Fortunately, this is rare. It only happens if angioplasty fails or you have complicated blockages that cannot be fixed with angioplasty in case of acute heart attack. Now, in very rare and specific circumstances, clot-busting medication could be used. This is very rare in U.S. because most of the population lives within 90 minutes of a angioplasty-capable hospital. However, if you have a heart attack in a remote area and local hospital doesn't have capability to perform angioplasty and nearest angioplasty-capable hospital is more than 2 hours away, then clot-busting medications could be used to dissolve the blood clot and restore blood flow that way. This is very common in other countries. After angioplasty, you'll be prescribed 2 blood thinners, aspirin and an additional antiplatelet agent, cholesterol-lowering medication or statin. Now, it's important that statin medication you have to take regardless of your cholesterol numbers. I hear that all the time from patients that my cholesterol is normal, therefore someone stopped my statin. That's not the case. Once you have a heart attack, you bought yourself a statin. Other medications that could be prescribed include a beta blocker, ACE inhibitor. Now, before you leave the hospital, make sure you talk to your cardiologist about cardiac rehab. Cardiac rehab is most underappreciated treatment after heart attack. Research clearly shows that cardiac rehab reduces risk of dying and reduces risk of readmission to the hospital with the heart symptoms. Cardiac rehab has 2 components. First is supervised exercise program, and second is health education and risk factor management. So once you go home from the hospital, your job is not finished. You have to focus on lifestyle changes besides taking your medications, making sure you're keeping up your appointments with your cardiologist. Now, what are the lifestyle changes? Routine exercise, eating heart-healthy diet, making sure you're getting enough sleep, managing your stress. And if you're a smoker before and you quit smoking, you can add years to your life. Please remember, your life may depend upon getting medical attention immediately. If you think you're having a heart attack, do not waste any time. Call 911 right away. Do not wait for your family or friend to drive you to emergency room. Again, my name is Dr. Sukhchain Singh. I'm a cardiologist with the Kettering Health. Thank you very much for watching.